Hello everyone. I'm Dr. Shaila Hirani, Associate Professor at the University of Regina, Faculty of Nursing. The title of my today's presentation is Impact of COVID-19 on Refugee Mothers in Saskatchewan, Canada, a Call for Action. COVID-19 pandemic has increased the vulnerability of mothers and young children due to the lack of opportunity to have the regular contact with the healthcare professionals and due to the inaccessibility to the breastfeeding and the newborn care counseling facilities. Worldwide, COVID-19 pandemic has created many challenges for the refugee mothers and families with the young children due to the substantial impact on their employment, economic burden on the families, food insecurities, marital issues, domestic violence, and subsequent effects of the parental distress on the child's positive emotions. Each year, Canada welcomes large number of refugees who are affected of either the natural disasters or the armed conflicts. During the first wave of COVID-19 pandemic, it was noted that some of the barriers that were affecting on the health and well-being of the refugee families included the barriers to the social economic support, healthcare, education, and border crossing impediments. In the Canadian context, there is a significant gap in the knowledge and the empirical study that actually focus on the impact of COVID-19 on the health and well-being of the refugee mothers with the young children. It is quite essential to explore the experiences of the refugee mothers with the young children in order to better respond to their challenges and initiate the need-based interventions and services in their best interest. In view of the knowledge gaps, the aim of this study was to examine the effects of the COVID-19 pandemic on the health and well-being of the refugee mothers in Saskatchewan, Canada. We employed the critical ethnographic study design in order to identify the range of factors that are directly and indirectly affecting the health and well-being of the refugee mothers in Saskatchewan, Canada. We chose Saskatchewan as a province because Saskatchewan is one of the growing provinces in Canada that has a large number of refugee families that are residing, and many of these families have the young children. We collected the data using the multiple methods, including the in-depth interviews, observation, and document analysis. Our sample included the 27 refugee mothers who were with the young children aged 1 day to 24 months. Majority of our sample were from the minority group, including from the countries like Syria, Eritrea, and Somalia. We undertook the in-depth interviews with these mothers, also observed some of the services available in Saskatchewan, and we reviewed the document in order to identify that what are some of the gaps in the offered services. During the time of the pandemic, we received the research funding from the Jim Pattison Children's Hospital Foundation. The collaborator for this study included the United Way Regina, Saskatchewan Health Authority, Regina Open Door Society, and Saskatoon Open Door Society. Now the findings. Our study participants shared that during the time of pandemic, they are feeling isolated, stressed out, and depressed. One of the participants, while sharing her concern during the time of pandemic, shared, as I quote, "COVID-19 affected me a lot. I was scared of anyone getting sick. I stayed home all the time with my kids and would only go out to get urgent things. COVID-19 restricted my freedom to go outside," unquote. Another participant shared that they also had the somatic complaints, and somatic complaints were evident in many mothers. Mothers shared that they experienced lots of tiredness, loss of appetite, and at times the allergic reaction. One of the participants mentioned, as I quote, "COVID-19 affected our psychological state. My appetite has reduced," unquote. Another participant shared, as I quote, "I'm tired, scared of COVID-19. I'm also depressed since there is no socialization anymore," unquote. Participants further mentioned that they are finding it difficult to access the healthcare. One of the participants mentioned, as I quote, "With COVID-19, I think it changed life in itself, especially during the lockdown times. We are not able to see doctors as easily because of the fear of going to the hospital, unquote. Participants further shared that there are restrictions in the hospital, especially for the visitors and the caregivers. Many mothers who were having the sick children who were hospitalized, and they were the neonates and the infants. Mothers were finding it challenging to stay with their young children in the hospital because of the COVID-19 restrictions. They mentioned that this experience made them more depressed and frustrated. One of the participants, while sharing her frustration, stated, as I quote, "It was such a frustrated time to visit my sick child during COVID-19. I would go back home crying. I was frustrated, tired, and depressed." Unquote. Another participant shared, "When the COVID-19 pandemic hit, the healthcare providers gave us a certain time for visits, 2 hours in the morning to see the baby and to meet the doctor, and 2 hours in night, and I was the only one allowed to visit." Unquote. Mothers further mentioned that during the time of this pandemic, they are having the limited follow-up care in their home setting. Before the time of pandemic, they were able to avail the healthcare supports at their home. But after the COVID-19, there isn't any such follow-up care facilities available. One of the participants shared, as I quote, "Before COVID-19, nurses used to visit the mother with a baby at home to check both baby and mother. However, with COVID, the nurse came only once to ask me if I need any help." Unquote. The refugee mothers further shared that they are having the limited social support in their host country, in Canada, in Saskatchewan, where they are not having the chance to meet with their relatives. The COVID-19 pandemic restriction has also made them far from their loved ones who are in their other countries. One of the participants, while sharing her feeling, mentioned, as I quote, "The absence of my mom and my sisters in Canada is hard, especially that my husband is busy at work in Canada." Unquote. Refugee mothers also mentioned and spoke about the financial difficulties during the time of pandemic that actually result into the compromised nutritional status of themselves and their family members. During the time of this pandemic, many families lost their job and found it difficult to find a new one where they can support themselves. One of the participants, while sharing her financial difficulties, mentioned, as I quote, "The salary we get is little, and we put most of it in the rent and bills. Everything here is expensive." Unquote. Another participant shared, as I quote, "If you don't have enough money, you can't buy food you need to eat and to breastfeed." Unquote. In view of the findings and all the factors that were affecting the health and well-being of the refugee mothers with the young children in Saskatchewan, Canada, few of the key recommendations based on the findings include: my first recommendation is it is essential to involve the refugee mothers and their family members as a partner in designing the innovative and the need-based programs that are actually meant to promote their physical, mental, social, and emotional health and well-being. During the time of this pandemic, use of the social media helplines telehealth are also recommended to provide the mental health care supports, skills building programs, offer the nutritional counseling, and offer the follow-up care to the refugee mothers in their preferred language. The third and the key recommendation is that there should be the partnership and collaborative efforts by the interdisciplinary professionals, governmental and non-governmental organizations. And these partnerships are essential to extend the social support, facilitate the resilience building, promote the mental health, and build the capacity of the refugee families during COVID-19. Here are the references that I used during this presentation. I would like to acknowledge my research team and all the collaborators who were of great support during the entire project. Here are my contact details. If you have any query related to this presentation or project, you are most welcome to approach me. Thank you so much for your listening.